Posology is defined as it is a branch of pharmacology that deals with the study of doses of the drugs and the factors which are going to influence the dosage. It helps in deciding how much drug should be administered to obtain the desired therapeutic effect. In short, we can say posology is a branch of pharmaceutical science. Is a branch of pharmaceutical science which mainly deals with the dosage of the drug. Hello everyone, welcome back to my channel. In this video, I am going to present an interesting topic called as posology. So in this video, I am going to discuss what is posology and what are the different factors which are going to affect the posology. What is posology? Posology is defined as it is a branch of pharmacology that deals with the study of doses of the drugs and the factors which are going to influence the dosage. It helps in deciding how much drug should be administered to obtain the desired therapeutic effect. In short, we can say posology is a branch of pharmaceutical science. Is a branch of pharmaceutical science which mainly deals with the dosage of the drug. How it is originated? So it is mainly derived from the two Greek words. One is posos, another one is logos. Here posos means it is about the quantity, means how much. Logos means study or science, means how much dosage is required. Hence, posology means the study of the drug of the dosage. What is the importance of posology? It helps in achieving the maximum therapeutic effect of the drug. The second importance is it helps in individualizing the dose of the different patients. Then it also helps in preventing the toxicity and adverse effects of the drugs because we know the safety level of the drug. Then it also guides the medical practitioners to adjust the dose based on the patient conditions. Then what are the different factors which are going to affect the posology, that is dosage of the drug? There are various factors like age is there, body weight is there, body surface area is there, sex is there, then route of drug administration, then time of administration, and tolerance, psychological state of the patient, pathological condition of the patient, then presence of the food, then drug interactions when multiple drugs are administered, then environmental factors, then genetic factors, frequency and duration of the dosage. The first factor is age. How the age is going to affect? Because there is a different age group people, maybe the kids, the child, and adult, maybe the aged person. Let's see how the age is going to affect. That is the ability of the body to absorb, distribute, and to metabolize and excrete the drug is going to change according to the age. Okay, why it is going to happen? So in case of infant and children, there is a there is a immature liver enzymes, means there is a not complete maturity of the liver enzymes which is going to reduce the drug metabolism, and the kidney function is also not fully developed. Then it also affect the excretion of the drug from the body, and higher body water and less fat. In case of children, there is a more body water but there is a less fat, that is going to affect the distribution of the drug in the body. Then blood brain barrier. Here, that is blood brain barrier is not fully or completely formed. That is going to affect the CNS drugs. Therefore, the children require smaller doses as compared to the adults, like paracetamol 125 to 250 mg. And in case of adults, the metabolism and excretion is very good. Hence, the standard adult dose based on the healthy adult of about 70 kg, it is a common weight which is going to consider in case of adult. And in case of old age people, that is elderly patients, here again there is a problem, that is reduced liver metabolism and decreased kidney function, that is going to reduce the drug clearance. Then there is a reduced plasma protein and higher concentration of the free active drug in the blood. Then increased fat content, that is fat soluble drugs accumulate for longer time. Then therefore the doses should be reduced in old age people to prevent the toxicity. Example like drug diazepam, which is used to induce the sleep, and digoxin. These doses are reduced in case of old age patients. And similarly, NSAIDs should be used very carefully to avoid the side effects. Here in this chart, we can see in the first column there is the age group, and in the second column there is the effect of the drug, effect on drug dose, then reason. So in case of children, there is a decreased dose, and because why means because of immature liver function, liver enzyme, and the decreased kidney function, and incomplete for blood brain barrier. Then in case of adults, effect on drug dose, it requires they require standard dose. Okay, there is no problem, normal metabolic function is there. And in case of elder patients, there is a decreased dose, and because the reduced metabolism and renal function. And the next factor is body weight, how the body weight is going to affect the dosage of the drug. The body weight plays very important role in deciding the correct dose of the drug, because the drug distribution, metabolism, elimination mainly depend on body mass. The dose must be adjusted according to the patient weight. That is why weight is the main factor which is going to consider. In simple words, a heavier person requires high dose, and a person who is having less weight require less dose. Then most of the drugs distributed throughout the body fluids and tissues. So the amount of the drug which is required to produce the desired therapeutic effect mainly depends on how much the body tissue is available to receive it. Hence, the doses are often calculated as milligram per kg of the body weight. Here is the formula, that is dosage in mg, dose per kg body weight multiplied by body weight. Then effect of body weight on dosage. A underweight person uh, who is having less body fat and muscle mass, the standard adult dose may be too high for in this case. Here they require less dose, otherwise it may lead to toxicity. Then example, an underweight adult may experience stronger effects of sedatives and opiates. Then in case of obese patient or overweight patient, here there is a more adipose tissue, which is going to affect the distribution of fat, fat soluble drugs. Example, diazepam and barbiturates. Then they require higher doses to achieve the plasma concentration or to achieve the desired therapeutic effect. But not all the drugs should be increased. Here is a chart. We can see there is a drug and a type, typical adult dose, then dose calculation based on weight. For example, there is a gentamicin drug. Usually the adult dose 5 milligram per kg per day, and the weight should be minimum 70 kg. And there is a drug morphine. Adult dose is zero point 0.1 milligram per kg, and the weight is considered as at least 60 kg. Then paracetamol drug 10 to 15 milligram per kg, 20 kilogram of child, at least 20 kg for 200 to 300 milligram. The similarly antibiotic is amoxicillin, 25 to 50 mg per kg per day. Means 25 to 50 mg of the drug is required per kg, and the duration is for 1 day. Here 40 kilogram of child may receive or will receive 1000 to 2000 milligram per day. Weight condition, effect of dose, then reason. Underweight require less dose because less tissue and slow metabolism. Normal weight, standard dose based on distribution. Overweight, high dose or more dose and a larger volume of distribution. Children, dose per kg because immature metabolism. In the case of elderly, they require less dose and because reduced clearance from the body. The next one is body surface area. Here some people may be tall or broad, and some may be short. Even if two people weigh the same, their body surface area may be different. Because of this, the drug distributes differently in their body. In short, if the body is bigger surface area, then require higher dose. If the body is short surface area or shorter, requires less dose requirement. Then sex of the patient. Men and women have the biological difference. That is body fat percentage, body water content, hormones, enzyme activity, organ function. The body composition difference. In women, there is a more fat, less body water. In men, there is a less fat, more body water. Here, fat soluble drugs stay longer in case of women, whereas water soluble drugs stay longer in case of men. Example, diazepam, it is a fat soluble drug. Hormonal difference. Hormones like estrogen, progesterone, that is going to affect the drug metabolism. Women metabolize some drugs very slow and some drugs very faster depending on the hormone level. For example, caffeine is metabolized slow in women, so effect will remain in the body for longer time. Enzyme activity difference. Some liver enzymes work differently between males and females. Women may have lower activity of certain enzymes, so the drug will stay for a longer period of time. Example, some antidepressants and anti-anxiety medicines stay longer in women, means they require a small dose, lesser dose. Drug elimination difference. The kidney clearance can differ in male and female. Usually, women have slight lower kidney clearance as compared to male, so the drug remain for a longer period of time. For example, digoxin drug may require low dose in case of women. Then, route of drug administration is going to affect the dosage of the drug because we use various routes. Okay, for we will see the oral route. So the drug taken orally, they undergo first post metabolism because they have to pass through the GIT tract, then liver, all those things. It will take more time to produce the onset of action, and the bioavailability is also less as compared to other route. Bioavailability means the amount of the drug which is available at the site of action to produce the therapeutic action. Example, propranolol. When it is taken through the oral route, the drug is going to destroy in the liver. Means the not completed drug, not the complete quantity of the drug will reach the site of action in case of oral drug. Similarly, the oral morphine 10 mg, whereas the IV, when we are giving the IV of the same drug morphine, it requires 2 to 4 mg, much lower. Okay, intravenous route. So effect on dose. So there is a 100% bioavailability in case of IV route because the drug is going to enter directly into the blood. There is no first pass metabolism. Then it requires lowest dose. Example, diazepam requires small dose than oral diazepam. Then IM route or subcutaneous route. So here the absorption is faster than the oral route but slower as compared to IV route. And here the moderate dose is required. Then no first pass metabolism. Okay. Example, insulin is there. Then subcutaneous oral dose cannot be given because insulin gets destroyed in GIT. There is no oral drugs available. It is only available in the form of injectables. Then inhalation route. It is a very effective route because the absorption is very rapid through the lungs. The drug is going to directly reach the target. That is example bronchi. Even a small dose is enough. Example, salbutamol as a bronchodilator drug, which is required in less quantity. Then sublingual or buccal route. So it is also going to bypass the first pass metabolism. It is not going to enter into the GIT. Even a small dose is sufficient. Example, in case of angina pectoris, that is in the heart care diseases, we use nitroglycerin about 0.5 mg, whereas the oral dose would need much higher. Then rectal route, effect on dose. About 50% of the drug is going to bypass the first pass metabolism. Here the dose varies less than oral route but more than the sublingual route. Example, diazepam rectal dose is slightly lower than oral dose. Here in this column, route is there, first pass effect is there, then dose required is there. Oral, yes, first pass metabolism is there, then the dose required is high. In case of IV, there is no first pass metabolism, lowest dose is sufficient. In case of IM route, that is intramuscular and subcutaneous route, there is no first pass metabolism and dosage required is moderate. In case of inhalation, there is no first pass, very low dose is sufficient. In case of sublingual route, there is no first pass metabolism and low dose is sufficient. In case of rectal route, there is a partial, means some amount of drug is going to in the first pass effect. and the dose required is moderate. In case of topical or transdermal route, there is no first pass metabolism and low are controlled. Then the time of administration, how it is going to affect the dosage of the drug. So the time of drug administration, mainly in the morning, evening, or before food, after food, at bedtime, that is going to affect the absorption, metabolism, therapeutic effect, and required dose. Let's see the presence of or absence of the food, how it is going to affect. The food can, if the food is there in the stomach, that is going to delay the absorption or increase or decrease the drug bioavailability. Then food is going to interact with the drug, so the required dose may be changed depending on whether the drug is taken before food or after meals or after food. For example, levothyroxine drug must be taken in the empty stomach for proper absorption. If it is taken with food, there is a problem with the absorption, that is absorption is going to decrease, then it might require higher dose. And day versus night dosing, certain drugs require different dosing because disease symptom may vary with the time. For example, in case of asthma, uh, the symptoms will be more or worst in case at the night time. Then here we require higher dose. Similarly, the sedatives and hypnotics given at bedtime so that the smaller dose is sufficient, because to induce the sleep at the night is very easy. Then frequency of dosing, the time gap between the doses is going to affect the drug concentration in the body. For example, if the dosing interval or the dose gap is too long, then the drug level will going to decrease or fall. Then it will require higher dose further. For example, antibiotics, the exact time gap between the two doses is 8 hours. If it is more than the 8 hour, means 10 hours to 14 hours, then uh, in those cases the patient require higher dose. Then time of administration affect the dose because because of the food interaction. Then day and night variation, dosing interval, that is the time gap. Then drugs may require different doses when taken before or after food, morning versus evening, day or night. Then another very important factor, that is drug tolerance, how it is going to affect the dosage of the drug. First we will go to we will understand what is drug tolerance. So when any drug is used repeatedly, means multiple times for a longer period of time, then its effect on the body is going to decrease. And to produce the same effect, the patient requires higher dosage because the body starts developing tolerance towards the drug. How it is going to affect the dosage? That will leads to increased dosage requirement. Then body becomes less responsive towards the drug because the body develops the tolerance. To achieve the same therapeutic effect, the prescriber requires uh, there is an increased dosage. Then there is a risk of overdose and side effects will be there, and there is a risk of toxicity may be there. Then there is a chances of dangerous side effects that is going to affect the vital organs. Then uh, drug may lose its effectiveness. Then the long term therapy is required, that may again leads to the toxicity and the tolerance. So there are many complications with the tolerance. Then psychological state of the patient, how it is going to affect the dosage of the drug. A patient's mental state and emotional condition can influence the how their body responds to the drug. Depending on the psychological state, the drug effect may increase or may decrease. Let us see in detail. Anxiety increases the dose requirement. So when the patient is in anxious condition or stressed condition or fearful, the sympathetic nervous system is more active or overactive. Because of that, there is an increased heart rate and metabolism also increases. Then body becomes less responsive towards these drugs, that is sedatives, analgesics and anesthetics. Then higher dose of these drugs may require to produce the desired therapeutic effect. Then relaxed or calm state of the patient. Here the drugs dosage is lower. Means if the patient is in the calm condition or relaxed condition, then a lower dosage is sufficient to produce the therapeutic effect, especially for these drugs, that is sedatives, hypnotics, anesthetics. And another thing that is placebo effect. A patient mindset or belief can change the drug response. Positive expectation enhance the drug effect, then he requires or the person requires lower dose. A negative expectation, that is nocebo effect, reduce the drug effect, and in those cases the patient require higher dose. Here is the chart in that column: psychological state, effect on drug response, then dose change. If the person is in the stress condition, there is a decreased effect and increase. There is a requirement of longer dosage or increased dose. If the person is in the relaxed condition, then increases drug effect, then that will decrease the dose. If the person is in depression, then there is a variable response, then careful adjustment is required. Positive expectation, that is placebo effect, there is a increased action, requires lower dose. Negative expectation, that is reduces the drug action, requires higher dose. Then how pathological conditions is going to affect the dosage of the drug. If the person is suffering from vital organ diseases or some pathological conditions or abnormalities in the organs, that is going to affect the dosage of the drug, because there is a change is going to occur in the absorption, distribution, metabolism and excretion of the drug. Because of this, the dosage may has to be adjusted and varies. In case of liver disease, it is a main organ for the drug metabolism. In case of hepatitis, cirrhosis, fatty liver failure, the metabolism of the drug is slow and require longer because the drug is going to stay in the body for a longer period of time. Then again there is a risk of toxicity. Then dosage should be reduced and dose interval should be closely monitored. In case of kidney disease, again there is a problem with the clearance of the drugs, that is excretion of the drugs. Then because of the slow elimination, the drug is going to remain in the body, especially in the accumulation of blood. Then there is an increased adverse effect. Then there is a chance of toxicity, especially in case of antibiotics like gentamicin. And some GIT disorders, that is also going to affect the dosage of the drugs, because it is mainly affect the absorption of the drugs. Then patient may require higher dose to reach the therapeutic level. But in but in case of gastric ulcer or delayed gastric emptying time, drug is going to stay longer in the stomach. That is absorption is unpredictable, we cannot predict the exact absorption. Then careful dose adjustment is required. Here is the chart in the pathological condition, effect of drug, dose adjustment. If there is a liver disease, decrease metabolism, decreases dose. Kidney disease, decrease excretion, decrease dose. In case of GIT diseases, decreases absorption, increases dose. In case of heart failure, decreases blood flow, decreases dosage. In case of hyperthyroidism, increases metabolism, increases dosage. In case of hypothyroidism, decreases metabolism, decreases dosage. In case of fever, increases metabolism, increases dosage. In case of obesity, increases distribution, increases dosage. In case of malnutrition, there is a decrease in protein binding of the drug, then there is a decrease in the dosage. How the presence of the food is going to affect the dosage of the drug? The food in the stomach can increase or decrease or delay the absorption of the drug in the body. Because of this, the doctor increase or decrease the dosage or advise taking the drug before or after food. Then food can decrease the drug absorption because it is going to interfere with the drug absorption. Drug is going to mix with the food, or food is going to mix with the drug. Then drug reaches intestine slowly. Then some drugs bind with the food components like calcium, proteins, or fats. This reduces the absorption of the drugs. Then higher dose taking the drug on empty stomach may be required. In case of tetracycline, it is going to bind with the milk. Then the effect is going to decrease. Then levothyroxine absorption decreases with food. Best to take in case of in empty stomach. Then food can increase the drug absorption. Dose may need to be decreased. Especially the food like fatty meals, that is going to increase. That is the blood flow to the intestine is going to increase. The solubility of the fat soluble drug is going to increase. Then the drug dissolution is faster. Then drug absorption becomes better and stronger. Then lower dose may be uh, sufficient to produce the therapeutic effect and to avoid the side effects also. Example, griseofulvin absorption is more with the fatty meals. Then carbamazepine antipsychotic drugs absorption improves with food. Food is going to delay the drug absorption, and it may also decrease the or slow the onset of action of the drug, because the food is going to slow down the gastric emptying time. Drug stays in the body in the longer in the stomach, then reaches the intestine very late. The action starts, that is the drug action is very late. Then dose may remain same, but the timing of the dose changes before or after the food. Example, paracetamol works slower when taken with the food. Then irritating drugs uh, must be taken with food to avoid the side effects, especially the in case of the NSAIDs. When they are taken in the empty stomach, that is they are going to irritate the stomach lining, that is going to lead to GAT disturbances and hyperacidity. And here there is a chart: effect of food, result, and dose adjustment. Decreased absorption, decreased drug effect, increases the dose. Increased absorption increases drug effect, reduces the dose. Delayed absorption, slow onset, adjust timing. Then protects the stomach, avoid gastric irritation, take after food. Increased metabolism decreases drug effect, then may need higher doses.